So here's in my mind, it's this. You guys, this is kind of cool. You guys will have clients that you might literally have in your life for 20 years. And that's not an exaggeration. And don't get me wrong, most clients will come and go. They'll be with you 3 years, then they move or they stop, whatever. And some clients will even get tired of you, I hate to say, because they've got the same massage for 3 years and, they'll move on to somebody else and maybe come back, whatever. But you will have clients that are with you for 20 years that you'll have a client that you meet when they're single. You'll meet them through their marriage. They'll get pregnant. And that's why you want to learn like pregnancy or maternity massage, because you don't want to turn them away at that point. So you keep working on them. Then they'll give birth and they'll ask about like, well, what about massaging my child? And so that's why we bring it up right now, is because those are the situations where you're like, well, I wouldn't actually probably massage your baby, but I can refer you to resources, or I took a workshop on how to massage children and I can teach you. And it's not that you make a lot of money out of that, but what it is that you want to stay bonded with that person all the way through all these different life things. So that's the only reason we bring it up. And I'm not teaching you guys infant massage. I'm not qualified to do that, but you can take one day, 2 day workshops on that. But you would probably be doing it for the point of working on your own infant or teaching your clients to work on their kids. Yeah. And the big thing, by the way, with infant massage is we watch body language, because they can't speak up. So we want to make sure that baby, if it's a baby, we're trying to make sure that they are cooing and making noises that make us think we have a happy baby, right? And a lot of it, by the way, is just compressions, like adorable little compressions around a baby. But it does help bonding between the parent and child. So sometimes fathers like to do it too, because it's sometimes a little harder for fathers to bond. And I don't mean because they're fathers. I just meant they're not breastfeeding. They're not doing some of these things. And so for them to kind of, bond and things like that. And we know it's super good for kids. Just touch. Boom.
Yeah.
I mean, life-saving good. We know that children that don't get touched grow up with a huge array of problems. I mean, it's devastating. Truly. And that's if they grow up. Children that really don't get touched, they've done some horrible studies a long time ago, and they die oftentimes.
Yeah, I think I heard about that. They touched one twin and the other one they just left in the crib and
it died. It doesn't matter. They can give them the best nutrient and everything. They feed them, but they have to have touch. And they've done a lot of touch studies with monkeys and such, and it's really sad. When they deprive them of a parent, they really do try to find a blanket or something that they kind of mimic as a parent. And then they have major behavioral problems later. It just messes them up. Part of our sense of I'm okay in the world comes from touch, and it's pretty dramatic. So, and that's true of adults too, but in childhood you're setting all that. So anyway, no, infant massage is usually to teach your client who just had an infant or has an infant, because they're going to ask you. That's it.
Okay.
Yeah. And probably much more important to learn pregnancy massage or maternity massage than infant massage. Yeah. Miss, you're very welcome. That was a good question. Miss Trotter.
So, is there an age limit on like how young or how old you can massage somebody? Because you can massage infants and you can massage somebody like 99 and they're still like whooping and doing whatever. Like, so does it really matter what age you can massage?
I mean, there might be legal considerations like, I mean, obviously you want a parent around if you're massaging their infant. I mean, right? Obviously I want to make sure, but like, no. If they can withstand a hug, they can withstand a massage.
Okay.
Yeah. And don't get me wrong, as somebody gets really advanced in age, I mean, obviously we're going to modify, and eventually we're going to be doing this very light lotion application, but yeah, there's no age limit. Yeah. And there are palliative care massage therapists. Palliative care means just providing ease and comfort. It means you're not fixing their back problem, you're trying to provide them relief. And palliative care massage therapists, there are some that work in hospices. In fact, that's the most common place they work. And so all they work on is people that are preparing to die. And it's really beautiful, really sad and really beautiful at the same time. And they're literally there to provide massage as a form of nurturing and just providing happy sensations to a person who's probably very uncomfortable and lonely. And it's just one of the most beautiful things in the world, actually. And you have to be a certain type of person, because you have to be able to be loving and kind of sit in that with them and also leave it there, right? Because you're of no good to people if you are just devastated, right? And you are losing clients. But you have to really just stay focused on the fact that you are helping people not die alone. And it's beautiful. But so yeah, no, you can massage them up to the very end. Yeah. And that's a cool job. Yeah. So yeah, no age limit. Yeah. Anybody else? Oh, Miss Sarno, sorry. Yes, Miss Sarno.
Yeah, in Thailand, when someone have the baby, like deliver the baby come out, and we will clean up the baby and put on like here,
Yeah.
and do the task, and the mommy and the baby will get closer.
Yes.
The feeling of the chest to the baby,
Mm-hmm.
the love that thing.
Yeah. There are some really interesting studies on this of two different types. One is that there's some important bacteria that the parents share with the baby. That there's most of the bacteria in your life is good bacteria, believe it or not. And so being close to the mom, that baby needs to pick up all that bacteria and things like that. But the other studies that are really fascinating are if there's any problems with the baby, they don't give it to the mother as quickly. And they do all these studies about like just how many minutes they take to get it to the mom and the problems that causes for the baby later on in life. So you're right, that touch is extremely important. Extremely important, yeah.
Yeah, and the baby, they will let the baby have the milk just on her chest,
Yeah,
the mom's chest, and have the baby from her chest.
yeah.
We believe that we will get very closer.
I believe it too. Yeah, it's a good thing. Yeah, it's beautiful. Yeah, I mean, I know, guys, I'm a massage therapist and we're in a massage program, but like massage aside, they've really proven that people literally live and die because of touch. It really does happen, and it's not a strange esoteric thing. It's medically documented kind of stuff. Yeah. So this is very important. You guys will literally save lives and help people out of depression and all sorts of stuff by just being there and rubbing them. Yeah, good stuff.
Sometimes only love cannot take away. Already in love or already love cannot take away the love.
I didn't understand. Say it again.
Like when you love your daughter, your son, and someone you really love from your heart, and you cannot take away your love.
No, you can't. It's there.
Yeah, if that when you fight or something, we still have the heart for each other.
Yeah. Yeah. I like that. It's true. Yeah. Okay. Good stuff. All right, let's talk about special populations. Let me share this with you guys. All right. So your book talks about special populations, and I'm going to focus on certain special populations here because I'm not super fond of this term. I honestly think the concept of special populations is this. Certain people are in certain situations, and I'll talk about those, and so they require special consideration. Well, to me, what I just said should apply to every single client you've got. Every client of yours is special, and they have special likes and dislikes and special lifestyle and special everything that should require you to modify your massage. I don't understand what's so different about that from anybody else. In fact, we're going to go into pregnancy massage a lot today because that is the special population I want to go over the most, that will serve you guys the most. But even pregnancy massage, really what we're looking at is somebody who is showing and can't lay on their stomach or back, and so we're making a special consideration to having them lay on their side to do a massage. And there are some other safety considerations we're going to talk about, but really we're just adapting to where they're at in life. To me, that's not, it's special they're pregnant, but what I meant was that's just everybody's got a special situation. I'm sure all of you have a special consideration, like don't touch my feet. My knees are a little bit sensitive. I don't like laying face down too long. It makes me get stopped up in the face. I have a particular job where my back hurts all the time. I need, whatever it is, right? You guys are all special populations. So that's my only thing that I don't like about it. But You guys already asked questions about adolescence and things like that, and this gives us an excuse to talk about different what-if scenarios with different types of people. Yeah? Cool. Okay. So, let's go. Okay. So, your book, though, defines special populations as that people that are vulnerable at risk for harm. And so infants are definitely vulnerable, right? That's why they have parents to take care of them. And pregnancy, I don't know if I call them vulnerable. Pregnancy is a situation we want to be extra careful in. We wouldn't want to do anything. Elderly people are more vulnerable, right? They're not as elastic and they don't bounce back as quick and things like that. So your book defines groups of individuals who are vulnerable or at risk for harm as special populations. And what they're really asking us to do is to exercise caution. Your book defines different types of vulnerability. Like you could be physically vulnerable, right? If you're very old, your bones are physically vulnerable of breaking, right? They're less strong than somebody who is younger. Psychological vulnerability, which again, I think we all suffer from, right? Some days you are psychologically vulnerable. But there are people with mental illness and things like that that can be considered psychologically vulnerable. And then there are people that are socially vulnerable because they live in neglectful families or they're minorities in our country. Those people are vulnerable as well. Although I don't think you're going to see as much of that on your massage table. So, all we do for special populations is figure out what their vulnerability is and try to adapt our massage techniques to fit their needs in the moment. So with pregnancy massage, that's like having them lay on their side, for example. That is a modification to massage because they are pregnant. Yeah? All right. You know what? I have a better pregnancy massage presentation for this, and you guys are better than this. I'm going to switch something here. Hold on. This will take literally no time. Because I have it right here. Sorry, everybody. Let's do this. Yeah. All right. Hold on, I don't know that you can see my new screen, so hold on. I'm just changing screens here. I think this is a better presentation than your book. It's a much more high-level presentation about pregnancy massage, which is the most important part of this chapter. Okay, so let's try this again. Can you guys see a nice blue slideshow that says Gateway Community College? This is a continuing ed course we actually teach to massage therapists. That's what I switched to. You guys definitely are ready for this sort of thing. So, pregnancy massage is also known as maternity massage, prenatal massage, meaning before birth, before, natus, birth. And sometimes you will hear it called antenatal massage, but usually, yes, Ms. Trotter, that's right, but not in the United States. Usually, you're talking to somebody from Australia if they call it that. That's very common over in Australia. And strangely, I know some Australian massage therapists, by the way, who are amazing. The schooling for massage in Australia is 3 years long, and so they tend to be pretty darn good by the time we see them. But anyway, so sometimes they call it antenatal. They're all the same darn massage. And I don't even know if there's a preferred way to talk about it. So, prenatal massage. Let's talk. Sorry, that's an online thing. Let's go over this. Okay. So, what we're going to do is talk a little bit about the research about prenatal massage. We're going to dispel some myths about prenatal massage because there is quite a bit of misinformation out there about prenatal massage. Talk about contraindications. What are contraindications? Who can tell me what contraindications are? Not what these specific ones are, but what does the word mean? Yes, Ms. Trotter.
I'll just tell you what I think it means.
Please.
I know it's like when you hear contraindications, it's like things that you're like, and they have certain ones you don't massage them type thing.
Right, Right. Actually, you're right. That's what the word is meant to mean. Yes. Contra means against. And so these are things that are against indication for massage, which sounds confusing, but what it means is these are things that make you say don't massage, right? So we will look at contraindications, like when should you not do a pregnancy massage, high risk factors, talk a little bit about the structural changes that happen during pregnancy massage, and learn target areas. Because of those structural changes that happen in a woman's body, there are classic areas they get sore when they're pregnant. Those are good to kind of know. And then we'll talk a little bit about how you position a pregnant client. And again, there are entire workshops on this. If you want to work on this in lab, work on sideline massage. That's what you need, which is a good skill anyway. Okay. And we're not doing that part. Okay. So you might hear this again as a massage therapist. Dr. Tiffany Field. Dr. Tiffany Field is a really neat lady. She runs the Touch Institute, I believe, in, I want to say Florida. Oh, yes, Florida, good. Miami. She founded and runs the Touch Institute, and it's one of the few places in the United States that scientifically studies the effects of touch on human beings. So massage therapists love Dr. Tiffany Field because she studies massage, essentially. And she has done, there's not a lot of massage studies out there because there's no money in massage studies. There's lots of money in pharmaceutical studies, right? It's just like there's no money in herb studies because you can't patent herbs. So nobody wants to study them because they can't own them, right? It's annoying. So nobody wants to study massage because they can't make any money off it. So anyway, she has though. She was able to prove that it really did help with decreasing rates of depression, anxiety, leg and back pain. And this was scientifically proven. And it was pretty dramatic. So, and they studied things like cortisol levels, which is kind of the stress hormone in your body. And when cortisol levels are high, you're stressed. And when they're low, you're not. And cortisol levels also tie into whether you're in fight or flight or, rest and digest. What do we call the rest and digest nervous system again? Yes, Miss Mejia.
The parasympathetic.
That's it, the parasympathetic state. And the parasympathetic state is the state that you are repairing and growing. Well, if you're a mommy with a baby, you want to be repairing and growing the baby. So it's really important to be in the parasympathetic state. Anyway, she's studied that. I think what was really fascinating about her study when I read it, and it's available online, you can go search her and you can read it, is that labor time was reduced by 3 hours for the subjects that got regular massage. Now, I never have and never will go into labor, but I have watched somebody go through labor, and I would have thought that they would probably appreciate 3 hours less of it. That's my analysis from what I witnessed. So that's a huge thing, shaving 3 hours off labor. Anyway, so the pregnancy massage is something that we've documented. There's a lot of massage where we're like, yeah, we know it helps because I've helped people before, but you can't point to a research paper. We know pregnancy massage helps in dramatic ways. It makes their experience better and literally healthier. There's some other research out there, but Dr. Tiffany Fields is the one who's known for doing the cleanest research that you can actually really verify everything she's done and all that kind of stuff. But anyway, so she shows like stress reduction and increased circulation and better breathing and better oxygen intake. Think how important that is for the child. And, the promotion of good hormones. And by the way, there is a lot of studies out there, and some of you may even know this from personal experience. Your state of mind during the pregnancy has a lot to do with your child's temperament later. So children that are carried while you're in a stressful situation pick up on the stress. I mean, this is proven. And they tend to have more behavioral problems. They tend to be more fearful. They tend to have more problems. They pick that up from the mother. The mother is sending them chemical messages that they read that says, it's dangerous out here, I'm stressed. So a relaxed, happy mom tends to produce a more relaxed, happy child. Right? This does not mean, by the way, if your friend has a wild, obnoxious child that she was stressed out during pregnancy. But I'm just saying, if you look at 100 pregnancies, they have shown that you actually have better outcomes for the child by having a really, so we always worry about like the environment we're setting once the child is outside the body, but it is picking up on the environment while it is inside the body. That's yes, Ms. Trotter.
So would it go with the same thing too? Like if the mom is having like mental health issues while she's pregnant, could that also affect the baby as well?
Yeah, it's not that she will give the baby those mental health issues, but her stress, the baby picks up on the stress, literally picks up the stress hormones and reacts to them. Yeah. So, and they tend to have all sorts of documentable problems then from that point. Yeah. That are, by the way, documentable problems that are related to dealing with stress. Yeah.
Yeah, and then so like if they're doing like drugs or drinking alcohol, because I know like with the drugs, the baby can like come out like addicted to it.
Yeah.
Would that also like affect like the stress hormones and stuff too?
Sure. I mean, it depends. Maybe the drugs are helping remove stress, but that's a whole other problem. But hormones are a drug. And so whether you're introducing stressful hormones or heroin, you're introducing stuff the child's not used to, right? The problem with drug use is really that the child's brain gets hypersensitive to those drugs. And if they tend to use them later, they tend to gravitate to them really fast. So because their body remembers. And unfortunately, that's not good. And so they tend to be more likely to become more addicted. Yeah. So, anyway, all that stuff is important. Reducing stress. I always tell dads that are my massage clients that the best thing you can do when your wife is pregnant is to be very nurturing during this time. Because the pregnancy, the delivery will actually go better, and the child tends to be more likely to sleep through the night sooner. All these things tend to go better, and everything runs smoother. It really is important to keep anxiety levels down. Yeah, super important. So don't forget, guys, when you're a massage therapist massaging a pregnant mom, yes, you're trying to relieve her back pain and her foot pain and all that, but a lot of what you're doing is just being that person to love on her, right? Because her husband loves her or her boyfriend loves her, but he's probably busy working too. They're probably both busy working, so it's your job to sit there and kind of provide that environment. Yeah. Don't underestimate the power of reduction of stress. Okay. So here are some myths about massage. There is a big myth that massage can cause miscarriage. That it can actually increase morning sickness, nausea associated with massage, and that massaging the legs and feet in certain areas specifically can cause miscarriage. So these aren't true. Not this slide, sorry. These myths are not true. There is not a single documented case, at least in the United States, of somebody miscarrying because of massage. Not one. Not one. But the problem is this. 20% of all pregnancies end in miscarriage. That's not a myth. And so, and 80% of all miscarriages happen in the first trimester. So, for this reason, a lot of massage therapists don't like to work on clients during the first trimester. But I want to be very clear about what I just said. I'm not saying, because this is how it's gotten messed up, and I would say if you talk to people out there, at least half will say the myth and believe it, even massage therapists. But this is how it got mixed up. We may not want to, I work on people in the first trimester, but you may not want to work on a client in the first trimester because it's very normal to have a miscarriage in the first trimester. But it's not that massage causes miscarriages in the first trimester. And we've gotten that switched around because a lot of places are like, oh, we don't work on people in the first trimester just to be safe. And people started thinking like, oh, that's because it could cause miscarriage. No. What the real truth is, and by the way, I so apologize as a male too that I'm talking about this because I'm sure that there are those of you out there who have experienced this. So I don't mean to talk lightly about miscarriage. anyway, but so the fear is that if I give you a massage and you have a miscarriage, you're going to think the massage caused it, and that's going to cause a lawsuit or something. And that's why most places, especially big chains, don't want to touch it. A lot of big chains. I don't know how Massage Envy is. Does Massage Envy, Ms. Trotter, have a rule? Or does it depend place to place or therapist to therapist?
It's more therapist to therapist, because majority of the time, like when they're in the first trimester, a lot of people don't tell you.
I know. I've done deep tissue on people before, and at the end they're like, "Oh, should I mention I was pregnant?" I'm like, "Nah." Because at that point, there's no point in saying anything. And actually, I really feel that way. I'm like, "Nah, yeah, you're not showing. Nobody knew. Like, it doesn't really matter." Because, by the way, I knew this fact to be true. That massage has never once been proven to increase the rate of miscarriage. They're completely separate issues. But anyway, I just want to explain that to everybody. After the first trimester, the risk of miscarriage goes so far down that most places work on their clients at that point. But that's where the big myth comes from. And by the way, a lot of people actually report from the studies they've done that massage reduces nausea overall during pregnancy, not increases it, which is another myth out there. There's some other myths too, just to make those of you aware who have not had kids. Those of you who have had kids have probably gone through these stresses. But there's something else that's really hard that happens to pregnant moms, not all of them, but everybody's super happy that you're pregnant, and you are too. However, you're also terrified, right? It's high stakes. And that can actually be very depressing because everybody's like, "Oh my gosh, the little bundle of joy is coming. You must feel so blessed. Everything's so great." And you're like, "Actually, I still have to work and I'm stressed out and how we're going to do the future. And I just had an argument with my spouse this morning and will I be able to take care of this kid? And I don't actually feel happy." And now, what do you feel as a woman? You feel guilty. And so you will find a lot of your pregnant moms feel guilty that they're not as happy as they think they should be during that. It's not that they don't want to be moms. It's just the pressure on a woman in our society is absolutely ridiculous. And so once you're pregnant, it's supposed to be like, "Oh my gosh, you've fulfilled your whole life process." And you're like, "Yeah, that's kind of why I'm into it, but I'm not feeling that right now." So a lot of what we do as massage therapists, 50% of maternity massage and probably all massage has nothing to do with massage. It's about you reassuring your client. And one of the ways, I'm not a psychologist, but one of the ways I reassure them is I go, "You know what? I know completely how you feel, not because I could possibly know personally, but because I have lots of maternity clients and they all report this when they're alone in private. They all report not being overjoyed at times and other times being very overjoyed. They all report feeling guilty. It is such a relief to have somebody tell you, your feelings are common. Because otherwise, you've got this Disney vision that you're supposed to live up to, and it just doesn't happen. Cool? So it is. It's the most beautiful thing in the world, but it doesn't mean it's not terrifying. So just don't forget that who you're talking to. You're talking to somebody who's under the greatest pressure in the world. They're supposed to bring a new life into the world, and the pressure is unbelievable. Oh, and that's what I was talking about here. That's the myth of you should be happier when you're pregnant. And a lot of people report they're not happier. Some people love it. Some people don't. But what you're there to do is reassure your client that it's okay. It doesn't make you a bad mom, right? Not everything about child rearing is fun. Here's some cool stuff. The American Pregnancy Association, the association, it's huge association, and it was formed to help inform expecting mothers of what to do when they are pregnant, what they should and shouldn't do. And they're very serious about it, and they're very careful about the information they give out. And they say, go get massaged. They say get massaged in the first trimester, get massaged in the last trimester, get massaged before all the trimesters, get massaged after all the trimesters, get massaged. They're totally fine with it. And that's the American Pregnancy Association. I tend to trust them. I won't go over all the other kind of reports here, but there are other studies and other experts in maternity massage that say the exact same thing. The only thing they do tell you to be careful of is if you have somebody who's had 3 miscarriages kind of in a row, that person you might want to wait. But we're not even waiting because we're concerned that massage might cause a miscarriage. There's just a lot to consider at that point. They probably should consult a doctor. So if you have a client that's, telling you that, oh yes, this happens all the time, that might be a person to say, let's get a doctor's release. But again, it's not because we're scared about massage creating that. But basically you have nothing to worry about in a healthy pregnancy. Healthy pregnancy. Also massaging the feet, ankles, all that stuff. There's some ideas that pressure points in your legs can cause miscarriage, and there's no evidence of it. And some of this, by the way, comes from some Eastern forms of massage where those points can be stimulating to your reproductive organs, but they still haven't proven it does anything to do with miscarriage. And I hate to be so blunt, but if it was that easy to abort a child, I am sure that people would utilize that to their advantage at times, and it's just not true. You can't push on your ankles and, make the baby be born. It just doesn't work that way. But here's what TAPSCOT does. Out of respect for my clients, these are the warning areas. There's one on top of your shoulder, one on your medial malleolus, just above your malleolus, one on your Achilles tendon there, and quite a few on your sacrum, and one right here in this muscle that pulls my thumb over like this. Hey, what would we call this muscle right here that pulls my thumb over? Kind of pulls it back to my body. What would be a good name for that?
Operator something.
What did you just say?
I think operate up.
Oh, you're thinking opinins.
Yeah.
Opinins is in here. But what's a muscle that pulls my thumb back? Adds it back to my adductor what?
Paralysis?
Yeah. By the way, Ms. Sarno, that's not kind of correct. That's 100% correct. You just applied the lessons I taught you. You knew this was adduction. You knew this is pollicis, and this muscle is called adductor pollicis. Good job. That's how it works. Welcome to Latin. You've learned a new language. Anyway, guys, I massage all these areas on clients, but I don't go pressure point them. I don't go pressure point them because, by the way, it's not my child, and I will take a little bit of caution. Like I'm not gonna, and some of these pressure points have been, around for 5,000 years. So, but I'm not afraid to rub over them. I don't worry about rubbing somebody's ankles. But am I gonna go dig in on that point on their ankle that's which none of us would do anyway, that's, 4 fingers above their malleolus? No, I don't do that. That's my caution. But don't ever worry that like, oh my gosh, I ran over the sacrum and it's all over. You're fine. It's fine. It really is fine. I more do this because I more avoid digging on those areas because I'm worried that the client will read something and then freak out and be like, what did you do? And I'll stress them out, right? So I do it out of respect. And these are the points you are supposed to avoid. But these are shiatsu points. But again, you can rub the hands, you can rub the sacrum, you can rub the ankles, you can rub the shoulders. If you want to be extra careful, don't dig in and pressure point those areas. That's it. We've already talked about that. So, no evidence whatsoever that massage is dangerous for pregnancy. If you want to be extra careful, you could avoid those pressure points. And really that's it. So, let's talk about a few absolute contraindications for pregnancy massage, because there are some. What is an absolute contraindication or a general contraindication? They're both the same thing. Thank you, Ms. Mejia. I like that. All right, we'll take that. Ms. Mejia says that an absolute contraindication or a general contraindication means this. Right? Absolutely don't do it. Yes, and there are some things. So here's what I do. When I have a pregnant client who says I'm pregnant, because that's the only way I would know basically, unless they're showing. And be very careful if they're showing. Because I've seen therapists ask somebody how the pregnancy is going and they weren't pregnant. So some people carry weight and they look pregnant the way they carry weight. So you got to be really careful. But anyway, I ask them, is the pregnancy going as expected? Is it a healthy pregnancy? If they tell me yes, that's it. That was the end of my questions. I'm not worried about a healthy pregnancy at all. I'm still going to put them on their side. I'm not saying I'm not going to treat this person like a mother with child, but I am not worried. I will essentially do a regular massage to this person. I'm not worried at all. If they tell me it's not a healthy pregnancy, that's when I worry, because this person, I'm not worried about the massage again, but I'm worried about them having problems and thinking it's the massage problem. So that's what but by the way, it is so rare for somebody to come to you and say, yeah, my pregnancy is not going well at all and I decided to go for a massage. Almost always by that point they've talked to a doctor and they're not going for a massage. So I've had a time once, by the way, when a client who I was her massage therapist through 3 kids. And on the 3rd child, which I will tell you the happy ending of the story, the 3rd child was born fine. But there was a fear that it was not going to be born fine. And she came to me and I said, so how's the pregnancy going? She goes, it's not good. And I was like, oh, well, we shouldn't do the massage. She goes, no, I talked to the doctor and he goes, it doesn't really matter now. I should just relax and be as happy as possible and only time will tell. So I trusted her and I worked on her anyway. But that was a situation where a client came to me and said it's not going well. But that is so rare, almost 99.9% of the time they wouldn't have come to you. They've already talked to their doctor, they're already sure it's fine, everything's fine. So I love asking, how's the pregnancy going, how are you doing? Is it all going as normal, planned, all that kind of stuff? Yep, going as planned, good, we're off and running. Now, if they come in and they have preeclampsia, I don't know that I've ever had anybody I know people with preeclampsia, but I've never had anybody come to me with preeclampsia because by the time they know they have preeclampsia, their doctors told them not to get massage. Preeclampsia is really common in twins, by the way. It is when the body starts to attack the uterus thinking it's a foreign body. And it causes all sorts of problems. And it can cause high blood pressure to the point where they can have seizures and a stroke. I mean, it can cause lots of problems. And usually they put you on bed rest and things to lower your blood pressure when you have preeclampsia. But if a client said, I've got preeclampsia, I would not do the massage on them. Again, I've never had it happen because they don't make it that far. They're on bed rest by that point. But preeclampsia is an absolute contraindication. There are problems. The body is attacking the uterus that is carrying the baby, and that's pretty serious. Deep vein thrombosis. Do not forget this term. DVT. Deep vein thrombosis. What's a thrombosis? Anybody know? It's a blood clot.
It's a blood clot.
Yeah, thank you. Thank you, Sir. It's a blood clot. Deep vein thrombosis is a blood clot. And the fear with deep vein thrombosis is that it usually forms in the legs, and here's why it forms in the legs. With pregnant women, the baby is pushing down in here, and that's cutting off blood flow down their legs. And so their venous return is not as good. The blood can't get back to the heart as easily because there's a baby pushing down on all these veins here. So that can make them more prone to blood clots. And the blood clot in itself is not a problem. But if the blood clot breaks free because you've massaged it really vigorously, it can go up to their lung. And then it's called a pulmonary embolism. And a pulmonary embolism can kill somebody. And so if you ever had a client on the table that started showing symptoms of shortness of breath, because they shouldn't have shortness of breath on a massage table. Nobody should, right? Once you're on the massage table, life should be good. If they are starting to have shortness of breath, chest pain, and starting to cough, call 911. Yes, Mr. Blygen.
2 questions.
Please.
So, with regards to DVT, do you have a picture of it?
No. I mean, it's internal.
Okay, so how would we know that they have that? Like, is there something that we can see on the skin where it's like pulling, or
There's a
it's
test.
like,
There's a test for it. I'm going to go over it. You're absolutely right. There's a test for it. And the test is,
okay,
yeah, there's 2 tests for it. One we can do and one they have to go get done. But yes.
and then as far as people who aren't pregnant who have DVT, is it the same thing
It
where
is.
they can't have it worked on, or that's also an absolute country?
It's also an absolute contraindication. Anybody with DVT, deep vein thrombosis, if you are aware of it, it's an absolute contraindication because, yes, for the same reason. It's the same problem. And so by the way, it's not exclusive to these 2 groups that I'm about to tell you about, but it's common. It's common with pregnant women, and it's common with people that are very overweight. But that doesn't mean you could be slender and get DVT, but it's unusual. It's much more common in people that are very overweight, by the way. I'm not talking about a little bit, but very overweight. Because again of that pressure pushing down and stuff not coming back up. And it can be fatal. And you guys know me, I'm like, work on it, don't worry about it. DVT is something to be concerned about. It's something to check for. And it's something to be aware of. And we will talk about exactly how to be aware of that, sir, in just a minute. Yeah. Yeah. So, yeah, if you guys take away anything from today, I haven't told you a lot of, I basically said if they can walk in and you can hug them, you can massage them. I still agree with that. But DVT, if you hear signs of that or things like that, you want to look into that because that could be bad. Or if somebody starts to get shortness of breath and chest pains and coughing on your table, that's a sign of that. That's a good time. People shouldn't be gasping for air on your massage table. It's not a hard place to breathe. That's a good time to call 911. That's one of the few times where I would start to go, whoa. Right? I'm not talking about them having a hard time breathing walking in. Maybe they ran in, I don't know. But on the massage table. Yes, sir. Mr. Black.
And then follow up, where typically is it located at on the legs? Like, is it in the thigh region and the...
Thigh and even calf. Deep inside thigh and calf. I don't know which one is more common. I'm trying to think of my personal experience. I just don't know. I think calf is even more common because it's even further down and it has a chance to kind of get below the knee. But I actually don't know that statistically, sir. I really don't. You might have to Google that one. Let's see. DVT more common in which part? Hold on. Let's see here. So that's 60% more common in the left lower extremity, but they're not saying what they mean by that. Yeah, they're not clear. They're saying this, they're just giving me the same vague answer I'm giving you, sir. Thigh or leg. Yeah. And by the way, the left side's only, I mean, well, 60% more common. And I don't know why that is. Yeah. But it is deep inside the thigh, deep inside the calf. That's where it's most common. Yeah. And let me get back to that in a second because it's really important to tell you how to test for it. So, there are all sorts of placenta problems too. Placenta previa and accretia and abruptions. Most of these create bleeding, and your client would be aware and would say, no, something's not going right. I'm not going in for my massage. I think the other rule of thumb here is if you have a pregnant client cancel their massage, let them, because they're probably canceling for a good reason, right? All right, so deep vein thrombosis. Yes? Yes. So, Mr. Brown. Sir.
Yes, Mr. T.
Mr. Brown, what does DVT stand for?
Deep vein thrombosis. It's a blood clot mostly found in the legs. You don't massage it because if you clear it, it goes to the lungs, and that is a pulmonary aneurysm. Oh. I don't remember how you said it, but I know what you said.
Dude, you said it. You said it. You want a job later? You can have it. That was perfect. I love it. Thank you, sir. So DVT, deep vein thrombosis. All right. Cool. Okay, so here's what you look for deep vein thrombosis. By the way, let me be very clear here. I'm going to tell you a test for it. The test is not 100% accurate at all. There is the 100% accurate test for deep vein thrombosis is an ultrasound. It's completely painless. You can go to one of those, you don't even have to go to the hospital. You can go to one of those emergency care centers. What are they? I don't know. Those little places you go to. What do they call them? Rapid care, emergency. What is it, Miss Mejia?
It's a little urgent care.
Thank you. Urgent care. You can go to urgent care usually, and they have a sonogram machine usually, and they can do it right there. And it's painless. And the sonogram looks for a blood clot in your deep veins, and they'll tell you right away. So that's where you would send a client if you did this test and you thought they might have deep vein thrombosis. So there's a test called Homan's test. Homan's test says that if you take a straight leg, and I'll show you this with the skeleton here, you take a straight leg and you pretty forcefully dorsiflex the foot, and squeeze the client's calf at the same time. If they feel that that is painful, that they might have deep vein thrombosis. Pain when you're doing that is a sign of that. Now here's the problem. You have to make sure that they are feeling like some significant amount of pain. We are not talking about muscle soreness here. So they should be like, oh my God, that hurts. And then you do it to the other leg and they're like, oh, it doesn't hurt there. That's what you're looking for. You're looking for one side to be like, oh yeah, that's achy. And the other side is like, oh my God, that's painful. You're looking for a big difference. But all you do, I'll show you with the skeleton, super simple. If you have a client, when they're laying on the table, you have their legs straight, oh, without breaking it, like this. Their leg is straight at the knee here, and you grab their calf, and you push this foot, and squeeze it. You just do it a couple times, squeeze, squeeze, right? And if they're like, oh yeah, it's a little achy, that's fine. If they're like, wow, that hurts, don't do it again. Go to the other leg, grab it, do the same thing, dorsiflex it, and if they're like, oh yeah, that's just a little achy, that would worry me. I'm looking for a difference in the two legs, a dramatic difference. Yes, Mr. Blige.
So would they have it only in one leg, or would it possibly be there in both?
I'm sure that there has been a person in history who's got it in both legs where we'd be screwed because they'd be like both sides would hurt, and I'd start massaging them because I'd be like, there's no way. But basically, no, it's always just one leg. Like, I'm sure there is a 1 in 10,000 chance or something like that, but no, you're going to get it in just one leg, and that's why you're looking for differences. And not a mild difference, not like, oh yeah, that one's a little bit sore, the other one. No, I'm not worried about that. I'm worried about like, oh yeah, that leg's achy. Ow! Oh, that's a big difference. And then you don't test again, because actually doing lots of the Homan's test can actually, it's massaging, and you can actually free up the blood clot. So at that point, and this is a really good thing to do, you can do it right when the client gets on the table, and they love it. I don't mean they enjoy the test. You're a pregnant mom and you get on the table and I go, I just want to test for DVT before we get started. What's that? It's a blood clot in your leg. It's not that common, but it's more common in pregnant women, and just for the safety of you and your child, I want to check. They love it. You're taking care of them. Anyway, if that happens, the second thing we want to realize is we could still be wrong. It's easy for people to have different pain in different legs. Who knows what's going on? So you don't want to freak out your client at this point. They're already a pregnant mother. It's really easy to freak them out. So at that point, you'd say, you know what? This is a sign of a possible deep vein thrombosis. And we can't massage you right now. You need to actually go get an ultrasound right away just to make sure that's not what it is. And they're going to be like, what if it is that? Well, they'll catch it and you'll be fine, which is 100% true. They'll catch it. They'll give them a blood thinner usually, and it eats up the clot, and they'll be fine because they caught it. Like, you're saving their life. And they also might go and get the ultrasound and be like, nope, nothing there. And then they can come back and get a massage next time. And this might happen to you once or twice in your entire lifetime if you massage for years and years and years. So I'm always super cool about that kind of stuff. I'm like, no charge the massage day. You come back, we'll reschedule whenever you want. Like, it's all cool. Let's just be extra careful with your child, right? So we are looking for differences in the two legs. Another thing to look for is a difference in swelling and heat between the left and right leg, right? If I see swelling in both legs on a pregnant woman, let me tell you, that's normal. She's got a child pressing down on her, her legs are going to be swollen. That's super common. Doesn't worry me at all. But when one leg's hot and bigger than the other leg that's cooler and smaller, that's a sign of deep vein thrombosis too. Blood is pooling up in that area and not getting back to where it's supposed to go. So uneven swelling is a concern too. Uneven pain, uneven swelling in the legs is essentially what we're looking for. And again, it's not a proof positive test. And you tell the client that, don't freak them out. But it's important enough of a test to have them go get checked right away too. So like I'm super reassuring, but I'm super like, you need to go get it checked right away. Yes. Yes, sir.
If you're working in a spa,
Yes.
like Elements or whatever, and you have a concern and you want to maybe have like maybe a more experience or the manager or somebody come in and check as well, is that something that you typically can do, or you have to be confident enough to kind of make that call on your own?
I would say be confident to make it enough on your own, and here's why. I wish I could tell you that yes, like your manager is always going to be there for you. But even if your manager is a good guy or girl, they might not be a massage therapist. I guess you could ask another therapist, but like they're going to just repeat the same test you did, and they're going to be guessing too. And you don't want to do the Homan's test over and over again, because that will free up blood clots too. Like doctors use the Homan's test over and over again when they're trying to pump loose a blood clot. So, I wouldn't, sir. And the other thing I want to tell you, sir, that I'm really sorry about is, but it's the truth, and this is for all of you to kind of remember, you're kind of on your own in your massage room. You really are. You can run out of there like if a client's being inappropriate and stop the massage and go tell your manager or whatever. That stuff you can do, but like you're the authority in the massage room. It's almost like the doctor walking out of the room to ask advice from a nurse. Like you're the doctor in the room, and it's your license that's on the line. And even if the guy said, "Oh, it's fine, go back in there and massage him," you're still kind of on the line. Does that make sense? So unfortunately, even if the client says, "No, I'm not worried about DVT, just do it," unfortunately, you're still liable. It really is your call. So I would say no, sir. You're on your own. It sucks, but you're on your own. I want to be very honest about that, so you're kind of prepared for that. And that is I think you'll end up liking it in the long run, but that's one of the tough things about massage in the beginning is because you go in the room and you're like, I got to figure this out. This kind of, whatever it is. There's always something to figure out. Yeah. Okay. So, Miss Lobitz, what's DVT?
Deep vein thrombosis.
Thank you, ma'am. Awesome. Deep vein thrombosis. It's the one thing that I really look for in pregnancy. And we're looking for uneven swelling and heat in the legs, uneven pain when we do a dorsiflexion of a straightened leg. By the way, I'm looking for uneven swelling right away. Like that's yeah. For years, I didn't even do the Homan's test. I would just look for uneven swelling. It's actually tells you a lot right there. Cool. Let's take a break right now. Is this a good place to take a break? 15 minutes? 4:55? Yes, sir. I can't answer you, sir. I'm on break.
I'll send you an email when you have a minute.
All right, you got it, buddy. Thank you. Da-da-da. Oh. There we go. And we're back. I still think we are. Is that right, Miss Mejia? 4:55? Good. What are we eating? Good stuff.
I'm eating some red grapes.
Red grapes.
Mm-hmm.
I love it. Okay.
I like new ones better, but these are all that were here.
Cool. All right. Okay, everybody. Let's hit this thing. So, thank you. Okay, so when we last left our intrepid explorers, we were talking about the miracle of birth. And we were talking about that it is such a miracle, and massage can essentially do nothing but to help it. but we avoid what are called high-risk pregnancies. So when somebody comes in and says, hey, I'm having trouble, that's a good time to get some, doctor's input on at that point. But that just doesn't happen because mothers don't want to risk things. They don't come in to get a massage when they're having trouble. And then we also learned that our biggest concern, by the way, as Mr. Ibarra just pointed out to me very kindly, with pregnant mothers, but also, by the way, people that are overweight and even people that are like, DVT is actually more common when people have gotten like a 10-hour airplane flight because their legs have been bent over a chair for a long time, especially if they're overweight and they've been on a 10-hour airplane flight. I don't want this to freak anybody out. Like, don't be worried every time you go on an airplane, but that's when it's most common. And so it's a good thing to kind of look out for. If you see somebody where one leg's hot and swollen and the other one's not, that could be a sign of DVT, and we do care about deep vein thrombosis because it can be life-threatening. So, and it's so easy to get checked. It's painless to get checked. So it's worth getting it checked. Okay. And we talked about the Homan's test for that and all that good stuff. So those are signs to call a doctor. When you see uneven swelling in one leg as opposed to another, if you see extreme swelling in the hands and face, that can be a sign of preeclampsia, which is when the body's attacking the placenta. And of course, if your client is complaining, especially while laying down on a table, of chest pains, difficulty breathing, that's the time to call 911. And for most of you, you'll never experience this, but I just don't ever want you to hesitate. Just think to yourself, why would somebody be asking for air on a massage table or even having a difficult time breathing, essentially? Okay. All right, let's do that. Okay, then there are relative contraindications. What are relative contraindications? Are they contraindications you're related to? Cousins that you should avoid massaging? Aunts that you should avoid massaging? What is a relative contraindication?
I'm going to say that it's something that you should be cautious of.
Yeah, I think I heard you say cautious, yes. And to me, like, everything is a relative contraindication, right? So these are just things that we are cautious of. So when we do see some swelling, like just regular even swelling, we're just aware of that. These are just things that we take into consideration. For example, like the recommendation for morning sickness, the relative contraindication for morning sickness is to have a trash can around in case they get sick. The other recommendation is to possibly prop your client up a little bit. Even when they're on their side, you can actually recline them by putting pillows under them. That seems to help with sickness too. So these are not things that stop your massage, they're just things to take into consideration. Yes, sir.
I think earlier when I was asking about DVT, I meant varicose veins. Because I heard some clients actually like them to be massaged heavily.
Yeah, so those are lower leg. And by the way, I did some research on the thing. DVT is basically lower leg. It really is. There are cases in thigh, but it's usually lower leg. But anyway, yes, you're talking about varicose veins, which are visible, right? And by the way, everybody, these are not spider veins. Spider veins are what we call the veins that you can kind of see under your skin, but your skin is flat. And you can see some blue veins under there or whatever. That's just a cosmetic issue. You don't like them, but there's nothing wrong with them. Varicose veins are actually raised above the surface. They look like they'd be painful. They look swollen, and they are a local contraindication. You're not supposed to massage them. And Mr. Blygen is right. Some people massage them. I'm one of them. But even I don't massage them vigorously. I go light on varicose veins because they can be ruptured, and that's why I don't go deep. So, sir, my advice to you would be like, look, I'm happy to gently work this area, but I'm not. It's a contraindication to work varicose veins. I'm definitely not digging around in them. And I don't blame them for feeling that way because their legs probably ache. But I would look at stretching alternatives instead of massaging the varicose veins directly. Because you're actually literally worried in that case about the pressure on the veins. So I would look at stretching as an alternative for that area. Which I realize is dorsiflexion, flexion, and plantar flexion, inversions and eversions of the calf, the ankle. Yes, Miss Walker T.
So is that relative consideration for varicose veins only during pregnancy, or
Oh
is
no,
it
I'm sorry.
also-
I'm sorry. That's the common belief for all varicose veins. Yeah.
Okay.
Yeah. The general rule is you just don't massage varicose veins. I'm just admitting to you guys I have bent that rule before, but I am aware I'm bending it and I'm still quite cautious. I don't go digging in on that area. Yeah. And if they look really inflamed and really, I just don't do it at all. So, but if they're looking kind of like, I'm like, looks kind of okay. I'll do gentle effleurage over that area if they want me to, but that's about it. Yeah.
Because we're afraid they could do what again? What did you say?
Rupture them, actually. The problem with varicose veins is what's happened is they really are veins, which are different than arteries, right? What do veins do?
Take blood back.
Yeah, and they're a low pressure system. Your heart's pumping out really fast and they come back up, and what happens is they have one-way valves, and the one-way valves start to fail on them and blood pools in them, and that causes the veins to expand, and it makes the blood, the walls of the vein thin, and so they can rupture. Which with healthy veins and arteries, you can't rupture them. You can sit there and try to chase the vein and artery and try to press it, you just can't do it, it can't be done. But with varicose veins, that's the fear, is that you'd rupture the vein. Won't kill them dead, you just cause damage and things like that. So if you look in the textbooks, they say, local contraindication, don't do it. Yeah. Miss Mejia? For anybody, by the way, I'm sorry, Miss Walker, pregnant, not pregnant, man, child, dog, tall, short, old, young. Yes, Miss Mejia.
So what do you mean by rupture? Because I thought bruises are when veins rupture.
Yes, it is. Bruises are when veins rupture, but usually they're when capillaries rupture. So capillaries are this, right? And they are bleeding. They're truly bleeding on the surface, but their platelets clog it up and you get a nice little yucky yellow, purple, whatever thing. But these are bigger, and so the rupturing can be much worse.
So would that be like an internal bleeding situation?
Yeah. I don't, by the way, I'm no expert on this, but I've never heard of anybody like, oh, I massaged varicose veins and they bled to death internally. It's more that you would damage those veins, and probably what you'd see is the legs swell up because of the internal bleeding, and they'd probably have to go to the hospital. Yeah. But you're busting open the piping in their body, yes.
Because I thought varicose veins, like, it just didn't work. And that's why they were like that, so they didn't do venous return. Is that untrue?
No, that is, as far as I know, that's untrue. They're just poor at venous return.
Oh, okay.
Yeah. And so the blood is pooling there, but there's still some movement going on. Yeah. 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 What happens is the one-way valves on varicose veins get messed up, and so blood has a hard time getting back up and it pools, but it does get back up. It doesn't just stay there. You'd have bigger problems if it wasn't moving at all. Yeah. And so then the weight of the blood literally is starting to cause the tubing to kind of expand. Yeah. Okay. Moving right along. We said avoid varicose veins. The reason this says to keep honey around is you can get gestational diabetes, which is diabetes just when you're pregnant, which you could get a low blood sugar. And giving somebody some honey when they have low blood sugar is a pretty good cure for low blood sugar. And remember, the signs of low blood sugar are disorientation, slurred speech, things like that. Mild edema swelling, mild edema can be helped with massage. So let's say my client comes in, she's pregnant, and both legs are swollen. That's normal. And I do effleurage them on purpose to get the blood back up on her legs. And I literally do it like this, slowly. This is in a healthy pregnancy. Everything's healthy. And you'll actually see the legs go down. I mean, I've seen it many, many times. And they'll go back up the next day, but still, you'll give them some relief for that day. It's not a permanent fix at all. But normal leg swelling is very common. There are pregnancy tables. There is lots, I don't know if there's lots of controversy, but there's lots of opinions about pregnancy tables. They do allow your client to lay face down. They not only have a cutout for the tummy, but this picture doesn't show it, but they usually have elastic mesh underneath there too. And many clients love pregnancy tables because they haven't been able to lay on their stomach, and some people are stomach sleepers. So they love them. And many big chains use pregnancy tables exclusively, so many people believe in them. But there are people out in the field who say, no, even with a pregnancy table, you shouldn't lay on your stomach, you should only lay on your side. I don't know if I have a strong, I think with a pregnancy table, I feel okay with it. I've used them many times. But I also understand the people out there that say you shouldn't even lay on your stomach, even with a pregnancy table. And I'm about to show you guys why. Here's the big concern. By the way, these are body cushions you can buy that lay on top of your massage table, so you can use them to adapt your massage table. But these last massage tables, these ones I just showed you, they're kind of cool because the neat thing is you can use them as a regular massage table. And nobody will know. Those are cushions that come out. And so your pregnancy table can be your regular massage table, which is kind of cool. And they do come in handy for other things. So you will get men with what we call very large bay windows, which means they're very fat in their stomach only. And when they lay on the table face down, they literally teeter-totter on their stomach. Well, I know of, and have used even before, men who prefer to have that little indent there so that they lay flat on the table. We get clients who've had breast augmentation or have sore breasts for some reason, and the breast cutouts can be nice, just more comfortable for them. So there are other reasons to have a maternity table that can make your clients comfortable. It's a nice option to have, and they make them portable. Yes, Mr. Blygen, sir.
So you can't really put any type of sheets on that, can you? Because it's gonna just cover the hole.
You can. You need big sheets, and what you do is you just kind of bunch them up down the hole. Does that make sense?
Yeah.
Yeah.
Okay.
And if you don't, like we have fitted sheets here, you're right, it does not work with fitted sheets, but you put a regular flat sheet on it and just stuff it down the hole a little bit, and it works really well. All right, so body cushions, all this stuff. I like the tables better than the body cushions personally. Here's the whole scoop. Here is why we don't have pregnant women lay on their back. And it's actually the same reason we don't have them lay on their stomach. So, your aorta, which is the artery that comes, your abdominal aorta, comes out of your heart and goes down your tummy, and it runs right in front of your spine, and your inferior vena cava, which is the vein that brings all of the blood from your lower body, and runs close to your spine as well, is between your back and the baby. And if the client lays on their back, the baby literally pinches its own blood supply and the mother's. Now, will this kill them dead instantly? Absolutely not. But you are reducing blood flow to the mother and the child because of that. All you have to do is even get them partially on their side, and all that weight goes over to one side, and you're no longer doing that. You get them completely on their side, and it's definitely taken care of, but even a partial on their side takes care of that. Or you get them reclining at 45 degrees. And they're fine too, so they can be in a recliner. Yes, like that, Miss Mejia, thank you. But that's the problem. That's why we don't have moms lay on their backs. And the same, this is what people argue about even in the pregnancy table when they're laying on their stomach. But we definitely don't have them lay on their stomach because they press against it. If there's a cutout, we believe it relieves that pressure. And it seems to be true. But that's what we're trying to do, is we're trying to prevent situations where the weight of the baby is actually crushing blood flow going out and back to the heart. Two problems at once. That's the big fear. It's that simple. And that's why we do sideline massage or have cutouts in the table or something. So this is even if the mom's flipped over, you have the same problem. Now the mom is pressing the arteries and veins against the baby, and that cuts them off too. We think with a cutout, it's okay. By the way, the cutout needs to have a support underneath it too, because there are ligaments holding the placenta in there and all that kind of stuff, and you don't want to have that just free hanging. But good massage tables have a cutout with this elastic mesh lining underneath. But that's the whole thing. So far your big three takeaways, in my opinion, are ask every pregnant client, how's the pregnancy going? Is it going expected? Is this a healthy pregnancy? And 99.9% of the time you're going to hear yes, and then it's smooth sailing. Second is look for signs of deep vein thrombosis. At least look at their legs when they're on the table and be like, Does this leg feel dramatically hotter, and is it bigger than the other leg? That's a big worry. Deep vein thrombosis. And third is, do not have them lay on their back. And don't have them lay on their stomach unless there's a cutout. Cool? Cool. That's really it. I just told you everything in this slide right here. Sideline is actually really neat for other stuff, and you guys, some of you guys have already played with sideline already, and it gives you some advantages to other types of massage. So as I've told you, I know some massage therapists, that's all they do. Pregnant or not, they do sideline work. And sideline massage also helps prevent stretching these ligaments that attach to the placenta and help keep it stabilized in the body as well. So that is the fear when they're laying face down. If it's not supported, it can pull on those ligaments too. Okay. So we never have them lie on their back unless they're at 45 degrees. You can have them on the table, but you have them 45 degrees, by the way, is like 45 degrees is diagonal. It's right across the screen. It's quite a steep incline actually. Just remember you have to have them at least up that high. Let's talk about some structural changes. Not a lot, because I want you guys to have time to get to your homework, actually. So in the first trimester, if the client doesn't tell you they're pregnant, you probably won't know, and it's probably okay. It really is. So if somebody ever tells you at the end of a massage that they were pregnant, don't look surprised. Be like, oh, well, it's a healthy pregnancy, you're fine. There's no need to stress them out. It's too late now, and really it was fine. It really was. Here's some of the stuff that we really want to be careful of. One of the things that pregnant mothers produce is relaxin. Does anybody remember what relaxin is? Can somebody tell me what relaxin is? I see some of you are feeling relaxed, but who was that? Oh, yes. Yeah, Miss Routson, please. What's relaxin?
It's a hormone that relaxes your uterus and I believe your pelvic muscles to make you stretchy enough to pass the baby.
Yeah, she's exactly right. It does all that, and that baby has to pass out of your body through here. And remember what this little symphysis is called, this cartilaginous thing, fibrous joint between your two hip bones here, right in front, that we can all push on ourselves right here? Pubic symphysis. Well, this is cartilage, and relaxin loosens that up enough that the pelvis can spread. And that's really helpful in passing a baby's head out between your hip bones. So relaxin is there to help you be loose and stuff, but because of relaxin, we are very careful about stretching pregnant mothers. It is not a time, if you're going to, I don't even stretch them at all, but if you're going to stretch them, this is not a time to be like, let's increase your flexibility during your pregnancy, because they will literally overstretch and actually be too loose. The relaxin makes their soft tissue too loose. It really does. So we do not stretch pregnant women because of relaxin. Okay? Also, there's a lot of structural changes that happen. Pregnant women experience a lot of the same structural changes that men who carry a lot of weight in front of them experience. It starts to pull their belly forward. And what does that do? It creates what kind of tilt on my hips when I have a lot of weight in front?
Anterior tilt.
An thank you very much. An anterior tilt, Ms. Manes. And an anterior tilt then exaggerates the curves of your spine, so that's where the neck pain, the shoulder pain, and the back pain come. By the way, if you're pregnant, they also come because there's a baby pushing from the inside on a lot of those nerves too. But the point is it changes pelvic alignment. And so it's very normal for somebody to be experiencing all sorts of these kind of discomforts that we all experience, but now they're exaggerated because they're carrying weight in front. We've all carried something in front of us, and it's actually very hard to do. So that's very normal. And so their back fascial line gets a lot of tension on it and such. And so those are very common areas for us to work. We'll work the back, and we'll work the low back, and we'll work the sacrum and all that, because the back is under a tremendous amount of, and we're not trying to fix it. What we're trying to do is just relieve all these muscles in back that are trying to pull me back this way. So, gastrocnemius in the calves, hamstrings, longissimus in the back, all that stuff. That's very, very, very common. And that is about all I want to share with you about that. Yep, we're going to let that go for now. All right. So, okay. So, questions on pregnancy massage so far? Thoughts on pregnancy massage? Anybody? No? All right. Don't forget, deep vein thrombosis, we're looking for unevenness and swelling. And we're looking for that in anybody. So, especially like, you know, if overweight guy comes in your thing, just got off a flight, and you see that his left leg is swollen and kind of hot, and his other leg is not, they're not the same size, I wouldn't care that he wasn't pregnant. He's obviously not pregnant, he's a guy, but I'd be like, DVT. That's the one thing that I might notice. I look for unevenness all the time. Unevenness really implies there's a problem somewhere. So don't forget about that little lesson. I would like to really fast, and I do mean really fast, I'll release your homework here. Just make sure there was nothing from the official book PowerPoint that you should know about. Not about pregnancy massage. We're not doing any pregnancy massage. We are flying through that. We've hit all that stuff. We talked about infant massage. Remember, that would be a special workshop, and you would be doing it to teach a parent about that. You probably would not be doing it. It's not that wrong that you would do it. I just don't think there's a lot of parents that are going to pay you to do infant massage. I don't know of anybody who does that. So we're not going to talk about that. Let's talk about children in the massage room really quickly. Some massage therapists are very comfortable working on children, some are not. I'm one of them. I'm very comfortable working on children. You will have clients when you go to their house ask you to work on their kids. You don't have to, but I feel like it's in their own home. It's the safest place to be. Most massage therapists' general rule of thumb is they want the parent around. Therapists that are really kind of worried ask to have the parent in the room. And that's a really good safety measure. If you're worried about getting sued because somebody thinks something went on, you can have the parent in the room. When I've been asked to do infant massage, child massage, usually it's like a 14-year-old. Usually they're athletes, by the way. The parent, I know the parent knows me. I've never had a problem with it. So, but I guess if a complete stranger came in and said, I want to drop my kid off at the clinic to get massaged, that I would be like, no, we want you around. We'd like you around. Just for that reason. And there's no special considerations for child massage. They are healthy, healthy, healthy. Just make sure they feel comfortable communicating. Try to put them at ease. They tend to be more ticklish. It's a little funky sometimes because they're tinier, but that's it. That's it. There's nothing else to consider whatsoever. Your book talks about tactical athletes. That's just athletes, by the way, that use their body a lot. Like firefighters are considered, even though it says athletes, are considered tactical athletes. They use their body a lot, so they tend to have lots of low back problems, things like that. The last thing I want to say is about aging. One of the biggest considerations about aging is more brittle bones and thinner skin. And for me, I'm not usually doing deep massage on somebody who's this aged, so I'm not worried about brittle bones because I'm not pushing as hard on somebody who's really old, right? I'm more worried about their thin skin and tearing their skin and easier bruising. And the solution is more oil. Use more oil and lotion on older people with thin skin. Solves everything. That's it. That's it, and don't use your elbow on them. Right? Things like that. But I meant just you go to more effleurage, less pokey moves, lotion, all that kind of stuff. And I do want to say this, by the way, we have an obligation, I think a very important one. And that is the clients that you want to touch the least need us the most. So when the client walks in the room and they're 97 and they look a little decrepit and some of their skin's flaking here and they smell like an old person, whatever that is, and their skin looks thin, that's the person that needs you the most. People don't touch people like that. And they die of loneliness. They really do. That is the client that lie, and you are so happy to see them. I love working with old people, and yes, we're doing this thing. And do the same thing with 450-pound clients. They are ostracized in our society. People don't want to touch them. They look at them judgmentally. They assume it is literally that they lack self-control, and it's not that simple at all, not even close, and they need you the most. So when people walk in and they're like, not your typical client, I'm always like extra glad to see them. They never know, not for a second. In the back of my mind, I'm thinking, how am I going to lift this leg? And oh my gosh, and whatever. But that's not what they see here. Those people need us more than anything, right? The supermodels are used to being touched, everybody. Okay? So just, and you will change your life. You'll have some of these people cry because nobody's just acceptingly loved them. So I think that's something we really, really need to look at. Last thing. I've mentioned this before. It's something to be careful of with elderly people, but it's actually something to be careful with everybody a little bit. It's called orthostatic hypotension. What's hypotension?
Low blood pressure.
Thank you. It's low blood pressure. And remember, I'm not worried about high blood pressure. I'm worried about high blood pressure in the gym if I'm a personal trainer. I'm worried about low blood pressure as a massage therapist. And what happens is some people get what's called orthostatic hypotension, especially old people. So I tend to help old people up and help them off the table because I don't want them falling. And that's what, think about it. Old people, you don't ever hear them getting hurt in massage. You hear about them, what? Falling. So that's what I'm worried about. But orthostatic hypotension means, orthostatic means body not moving, low blood pressure, orthostatic hypotension. And they're not moving and all of a sudden they sit up really quick and they get a rapid drop in blood pressure. It comes right back. It's not life-threatening. The only part that's life-threatening about it is they could pass out and hit the ground. So I love to help those people. I actually take the sheet. I'm happy to come to your lab and show you exactly how to do it. Flip their leg around and I sit there with them for a second and rub their shoulders and just make sure they're not doing that on me. That's it. Orthostatic hypotension is something just to be aware of. And again, I've said this before, but I'll say it again. If you actually have the thought of, I wonder if they might be passing out, while you're thinking that thought, please be reaching a hand out to grab them. Because almost everybody I've ever seen pass out, there's people that literally go, hey, are they? Boom. It's too late. So the minute I'm thinking, are you passed out, I'm already kind of lunging towards you. And then later I'm like, oh, I'm sorry, I thought you were going to pass out. but just the minute it comes through your mind, just start doing something. Don't sit there and go, but I don't know if I should. They're hitting the ground while you're saying that. So if you ever kind of see somebody, just kind of grab them. Just grab them. Grab anything. If they're falling, grab anything. Okay? So that's it. I just want to make sure we didn't leave off any big stuff from that lecture. I'm going to release your stuff. You have a test on this. And a video. That's it. So you have 2 assignments tonight. No TED Talk. No discussion. And I'll tell you, one is number 53 test on these special populations. And number 54 is a video about hip adductors, which we'll be talking about tomorrow. Those are the 5 muscles that live in your medial femoral compartment. So, test on this and a video on hip adductors. Those are your 2 things that are released. I'm here. I appreciate you letting me talk to you so much today. But I'm here for questions, all that good stuff. We got 36 more minutes. So, hit it.